Quality is perhaps one of the most important topics we can discuss. Quality-based care is a hallmark of physical and occupational therapy. Demonstrating our treatment effectiveness must be evident to be accountable to patients, managers, employers, and funders. Quality improvement is a systematic and continuous process that leads to measurable improvement in healthcare services and the health status of certain patient groups. These are the objectives that we're going to cover today. Please review them and become familiar with them. They are also posted on the portal in our course, Unit 6, Quality. Eight years ago, the Institute of Medicine published a report, "To Err is Human," and it revealed that between 44,000 and 98,000 Americans die each year as a result of medical errors. Medication errors alone are estimated to cause more than 7,000 deaths annually. Let's compare that to the annual deaths from workplace injuries, which is approximately 6,000 deaths. Although much of the discussion of medical errors has focused on the hospital setting, errors can occur in other settings as well, such as physicians' offices, outpatient surgical centers, nursing homes, pharmacies, therapy offices, etc. So when we define quality, we speak to the various factions, and I mentioned it. So quality from the provider perspective, which is us, what do we mean? Our view tends to be, the view of quality is the technical sense, accuracy of our diagnosis, the appropriateness of the therapy that we provide, and resulting outcomes. So we characterize it as the interventions. From the consumer's perspective, however, our patients, are they happy with what happened? Did the therapist seem sincere? Did they care? Did they help? This is a patient's. Now you can see our outcomes may be the actual improvement in walking distance, improvement in endurance, improvement in heart rate, whatever. From a patient's perspective, their perspective of quality is were they cared for? And that's an important thing. Third-party payers want to know, did the therapies, were they cost-effective? And that's the same thing as our employers, our bosses, right? They want to make sure, did we provide the evidenced care to provide the most efficient care to our patients? And field experts, what do they say? They consider interventions as having a high quality if they are evidence-based. So what do patients really want from healthcare? What do they really want from you? These are some areas, and I'll let you review them, please. The main things that patients want. And how do we link what patients want to what we need to provide? There has been a whole focus in quality as of late that is moving it away from us telling the patient what they want to including the patient in the care and having the patient identify what's important to them. I just want to discuss this. No OOPEs is no out-of-pocket expenses. And that's an important thing for patients. They don't want to have to pay co-pays or something like that for the services that they provide. So quality in healthcare, you can see, is a wide variety, and what it means to some people is when they're sitting waiting in a waiting room. If it's a short time that they wait to see their doctor, they consider that quality. To others, being treated politely by the doctor staff means quality. There are those who define quality in healthcare by how much time the doctor devotes to examining them. So while these are important, the clinical quality healthcare is even more important. For instance, if you take your car to a mechanic, the people in the auto shop can be friendly and listen to your complaints, but the bottom line is, did they fix the problem? Similarly, when you go to a physical therapist or an occupational therapist, you want them to fix your problem and help make you better. So how much improvement a patient achieves based on the care and services we provide, that's what we're talking about. So here we have, when we're talking about quality of therapy of services, it talks about what happens to the patient, the care delivered, the organization's structure to help coordinate everything, and the external environments. It's not just the clinical skills of what we're providing. All of these contribute to quality. The fundamentals of independent variables in the delivery of therapy services. This shows some of the complexities and how do we balance all three. Sometimes this is referred to as the iron triangle. The three components of the triangle are access, cost, and quality. If patients have access to care, but it's not quality and it's high cost, then is that truly a good service? You can improve quality, but that will either result in increased cost or reduced access. So when we think about our patients through the Affordable Care Act, they are trying to decrease the cost of care, increase the access to care and services that a patient needs, and still attain or maintain that high quality that is demanded. So these are all really very, very important aspects. Access, quality, and cost of care. Would you accept a lower quality health care if it was lower cost? Should a clinic lower its cost by denying services to a certain population? I think all of these things. So, and I think that last question asks it very poignantly. What they actually mean is, if it's too difficult to bill, let's say, for a certain type of insurance, and the clinic decides, you know what, they make me do so much paperwork to submit my claim, and then it takes them so long to come through, I don't want to deal with that contract or that provider, then they're denying services to that group of patients. Well, it certainly would cover their overhead costs of their office support people, but is it truly what they want to do? So the government has a quality agenda. And back in 2001, there was this fabulous development, and they wrote Crossing the Quality Chasm, a New Health System for the 21st Century. And we spoke a little bit about this, I believe, in the financial modules, and I've got a link to a YouTube's later on in the online section that you should become familiar with. But basically, Crossing the Quality Chasm looked at the healthcare system and they said, what's important? What are the 6 most important things that we need to do in healthcare to assure that the highest quality is always achieved? So the first one is safety. And what it talks about is avoid injuries to patients from the care that is intended to help them. Well, that's an important thing, you would think. Of course it is. These are all from Crossing the Quality Chasm. Then, is it effective? Do we provide services based on our scientific knowledge to all who could benefit, and refrain from providing services to those unlikely to benefit? So, and again, you might look at the provision of various modalities in your treatment. Is there evidence to show that it's of benefit for certain types of patients? And if it is, fine. And if it isn't, then we shouldn't incorporate it into the care that we provide. Is it efficient? Avoid wasting time, such as a waste of equipment, supplies, ideas, and energies. Is it timely? Do we reduce waits and sometimes harmful delays for both those who receive and that give the care? Most important, is it patient-centered? Are we providing care that is respectful of and responsive to individual patient preferences, their needs, and their values, and ensure that the patient values guide our clinical decisions? And the final one is equitable. Are we providing care that does not differ in quality because of personal characteristics, such as gender, ethnicity, geographic location, or socioeconomic status? These are the 6 components that Crossing the Quality Chasm highlighted as currently as being deficient in our healthcare system, and urged all parties to commit to a national statement of improving these 6 dimensions of quality care. When you build your business, it's important to address these areas to assure a balanced approach to the best services for our patients. And these are the areas that I've just spoken about. And we have a YouTube out there that you can review as well. And I've incorporated that at the end of the presentation. So, 3 main quality defects in healthcare, including therapy, are underuse. So, we may not treat the patient as much as they really require based on current scientific practices. Overuse, we see the patient too many times and aren't getting any progress from the services. And misuse, failure to appropriately execute proper clinical care processes. Now, I just put this in to kind of show, I've got a couple of these cartoons to show really this is a huge problem. Medical errors, poor consistency and quality and follow through, and all of these impact on truly patient outcomes and quality care. We need to think carefully. Hospital medical errors kill 98,000 Americans each year. Millions of our patients suffer from mistakes in the healthcare environment. Some of the more common ones are medication errors, surgical errors, infections that occur during hospitalization, wounds that develop during hospitalization or nursing home stays. Why do mistakes happen, and how can we prevent them? The studies show that accidents actually happen because people are overstressed, systems might be too complex, and the whole thing about quality is not to place blame when something wrong happens, but instead to tweak it apart and find out, why did that happen? And if it happened, what was the process or the procedure that broke down? And if that broke down, what can you do in the future to prevent that from happening again? And that's what quality is all about. So when we talk about quality assurance, it's comparing your practices to standards. So are we providing the most up-to-date standards based on our profession? Quality is the highest quality of healthcare by constantly measuring the effectiveness of what we provide. Quality assurance is the process-oriented and focuses on defect prevention. So we want to prevent errors from happening. So quality assurance identifies deviations from the norm. We have set standards, and if people follow those standards, errors don't happen. If an error happens, then you establish new standards with new criteria. And the idea is that you're always defining optimal and achievable levels so that errors don't occur. So this is prevention. Quality assurance is to prevent errors from happening. However, what happens if an error does happen? So quality control is if you have a problem, then you've identified it, and now you have to decide, what are you going to do to correct it and prevent it from happening again. And that's what quality is about. It sets the standard of care, it identifies when we deviate from it, and then you put systems in place to make sure that you don't deviate from it again. So, for example, let's say your patient, you had 3 or 4 patients who had infections break out in your clinic. And then you find out that one of the clinicians is not using good infection control technique when they're doing wound care or wound dressing. So what you've done is you've identified that there is an infection breakout. You want to identify why it happened. You want to identify what was it in the process that broke that down. You need to put a plan in place to prevent it from happening again. You have to re-educate your staff, retrain your staff, assure that there's competencies, and you want to control and continue to monitor to make sure future infections don't occur. So that's what quality control is. Quality improvement. So quality improvement is the formal approach to analyze the systems to improve them. Now there are a number of commonly used techniques that you'll see: continuous quality improvement, total quality management, Six Sigma, plan, do, study, act, fade. All of these are systems that different companies use, and they use it as their process wheel to make sure when they have a problem, they're analyzing it thoroughly and making sure that they're correcting it. So as I mentioned, quality improvement is targeting areas that are deficient or that deviated from the norm, and it's trying to improve the care so that everybody goes back on track. It could be med reconciliation. It could be a patient had a med error. Well, maybe the therapist went out and saw that patient and didn't do med reconciliation at that visit, or they weren't comfortable in doing it. It could be patient identification. Sometimes there have been errors in the past where the wrong patient was treated in a nursing home or even in home care. Patient identification. So one of our accreditors, Joint Commission, developed what's called the 2-patient identifier, and that everybody within an organization uses the same 2 indicators to make sure that the patient you're about to touch is the patient you need to touch. So the first time you meet a patient, you need to clarify, is this the patient? Sometimes they may ask your date of birth. Sometimes they may ask your address. They may ask your name. It's whatever your organization sets as the process for patient identification. So staff identify what outcomes they believe measure quality, and we identify how to measure them and improve on them. So in any one of those plans that I showed you, it's based on a model that was put in place back in the 80s, and it's structure, process, outcomes. Every single thing that we look at is based on structure, process, and outcomes. So quality in healthcare is evaluated on how the care is organized, what's done by the caregivers, and what outcomes have been achieved. And if we always build our plans based on the structure, process, and outcomes, we can identify and improve our systems. This is just another graph where it talks about assessment, interventions, and measurements. Again, patient and family is the focus here, that we want to always assure that our outcomes are thorough, that our assessments are evidence-based, and the interventions are effective. So this is what this is. This is the aim for healthcare. This was developed by the Institute of Healthcare Improvement, and it's improving the patient experience, including quality and satisfaction, improving health of our populations, reducing the per capita cost of healthcare. Patient and family is the central unit of care. I just want you to become familiar. I showed you a couple of different models that they use. This is the FADE model. When you're looking to improve quality, it looks at focus. you focus and define what the process is that needs to be improved. So you've identified that maybe you have a lot of patient complaints in your clinic. Well, you want to say, well, wait, why are we getting those patient complaints? You define what the problem is, then you're going to analyze and collect data to see why that happened. You're going to develop a new plan based on what you investigated and found out. And you're going to, after you develop it, you have to teach the plan and make sure that you educate everybody. And then you want to go back in a little bit of time and make sure it's still occurring. And I think that this is the FADE principle, which allows you to have an organized process. The next one is Plan, Do, Check Act or Plan, Do, Study Act. And this is another process study, and this is used a lot in healthcare. We use it in home care and hospice all the time. I think they use it in nursing homes all the time. It's the same basic thing as the FADE principle. Whatever your company uses, it's your thought process to break down a problem that occurred and to put in process a new improvement plan so that it doesn't happen again. So plan, you want to revise your processes. Do, you want to implement the plan. Check, you want to check to make sure what you're doing is right. And act, okay, you want to decide on changes that need to be modified as well. So these are just two cycles that people use, the FADE or the Plan, Do, Check, Act. But they're all based on that basic principle of structure, process, outcome. Structure what you need to do, develop your processes, do your outcomes, and these cycles then say, and check back to make sure what you did is still working. So what's the difference between quality improvement and quality assurance? Quality assurance is reactive and retrospective. That's when, oh, you've got a problem, you have to go back and fix it. And in the years past, it was really decided to determine who did something wrong. Whereas quality improvement involves prospective and retrospective reviews, and it's never pushing blame. Instead, it's an open process where you interview and investigate, and the whole goal of quality improvement is preventing it from ever happening again. And that's where it tends to be much more involving the entire team, to finding out, getting everybody to buy in and to improve the overall quality of care. So quality improvement is a much more inclusive model that we tend to use. So what are acceptable levels of quality? Healthcare providers share a common goal, and we all say that we want to provide high quality of care to our patients. Measuring our performance can help us to understand how well we're accomplishing this goal. And it allows for us to analyze where and what changes need to be made. Measuring performance allows providers to understand what's working well, information that can be shared with other providers, and learning from our successes. So these are a sample of some of the reviews that we look at within the healthcare environment to see how are we doing. So compliance audits. Compliance audits, we may look at, I think we go into it a little bit more, so I won't speak too much. The internal review audits. This is where we do audits and surveys of our medical records. It's where we want to make sure that if we say that from the time a call comes in to the first appointment is within 48 hours of call, then we want to do a survey and make sure that if we've set those standards, does that actually meet? Sometimes compliance audits means that if an insurer requires a certain thing to occur, we would do an audit to make sure that, again, we've met the requirements of that. Other utilization reviews tend to be how much services we provided for a particular diagnosis throughout the course of care. policy and procedures compliance reviews may have us looking at our infection control process and policy and our staff following that. It could have to do with our client satisfaction surveys. And there's a lot of people that feel like client satisfaction surveys are not always as effective as they need to be. However, I want to be clear that the federal government believes that client satisfaction surveys are an excellent outcome of care, and that it's publicly reported now up online. And if you go to Home Health Compare, Hospice Compare, I'm sure Hospital Compare, there are websites that the federal government puts up that shows the results of satisfaction surveys. Now, I don't know about you, but when I go to a new doctor, I want to know how are they rated. I want to know what other people feel about them. It's not saying that they're great at the technical skills, but if they don't have the people skills, I don't necessarily consider them for the care for my care, because I feel like somebody that I can communicate with is very valuable to me, and therefore I would want to make sure that other people have viewed this person that way. So internal review systems might check our compliance with our policies, and they're really very important. I just want to make a quick statement regarding policies and procedures. And every department should have a policy and procedures manual. And what it does is it meets the basic requirements of the law. It may have your emergency preparedness. What's your fire drill procedure? It has the mission of your organization. It has the values and the vision, and it has how long you'll maintain your medical records, and it has lots of policies, are pretty standard sorts of things. Whereas procedures are the actual step-by-step process. So your policy might say staff will be educated on infection control annually, and your procedure might be, these are the steps that we do for infection control, and every staff person will utilize these measures on a routine basis. It ensures compliance with your laws and regulations, accrediting organizations, and it promotes consistency, safety, and best practice. Policies are the rules, as I mentioned. Examples: non-smoking, non-clinical for the organization. That's the policies. Whereas the procedures are the more clinical components. So a typical policy manual would have your HR. When we speak of scope of services, we're talking about things like we're going to provide services to children under the age of 18 who live in St. Johns County. Okay, so that's your scope of services. You're going to provide physical and occupational therapy to children under the age of 18 who live in St. Johns County. That's your scope. Okay, with neurological conditions. And so that's your policy. Your procedures are how do you provide your neurological care? What assessments do you do? And so on. So the procedures are the way of accomplishing that action. Series of steps to provide details on the skill. So procedures to disinfect a treatment table. Methods for scheduling a new patient. Those are the procedures. I already mentioned client satisfaction surveys. Those are our internal reviews, but we need to submit those if more and more Medicare is changing the regulations and requiring that if you want to get the full reimbursement from a Medicare, from the government for Medicare services, that you will submit your satisfaction surveys to the federal government. Or you have to often have an external vendor do your satisfaction surveys, and they use that to rate the quality and services that an organization does. And once again, I feel like client satisfaction surveys, although not standardized, really give a good measure of how the care and services were perceived. There are times when you might, and we've satisfaction surveys have been in home health and hospice for a long, long time. The information you can walk away with, it might say, did you access our on-call system? And the family said, I called, but there was no answer. Well, that's a huge problem. And so you would dig into what happened, why did that happen, were they calling the right number? Often if you get a satisfaction survey that has a negative response, the manager calls the family and says, gee, I'm sorry, we got your satisfaction survey back and we noticed that you weren't pleased with our on-call service. Could you tell me a little bit more about that? I really want to understand what went wrong so that we can correct it and make sure no other patients or families feel that way. So satisfaction surveys truly give you an indication about the cares and services that you provide. Now, sometimes you do have some people that just like to say things aren't good. But you know, it goes a long way for a manager to follow up on those negative comments to the patient and family, because then they feel valued and respected and important in the delivery of the care that they received. And it's really interesting that this is what a consumer looks at. But good service is whatever the customer says it is. Make sure that the service we provide meets your mission, vision, and values. If you say you're going to be the best outpatient department for women's health in the area, providing high-quality, evidence-based care, then you need to make sure you do that. And you need to make sure that, based on your mission, vision, and values, that you're going to assure that every woman that comes into your clinic is receiving the same quality care. Now, there are a number of external audits, evals, that go on as well. So we've got our professional associations, APTA and AOTA, accrediting agencies for home health agencies. So APTA and AOTA might consult with our governments, our states, and help them write the licensure law. The federal government has certain guidelines for Medicare, the state governments for Medicaid, and these are independent accrediting bodies. So all of them impact on what we're doing. So I'm just going to speak to APTA, but if they have a minimum standard that every 30 days care is supervised by a PT, PTA care is supervised by a PT, but in home care it needs to be every 14 days or in outpatient, then you need to make sure that you're meeting your state regulations all the time, because otherwise you're practicing outside your scope of practice. If the federal government says every patient that is admitted with COPD or every patient that's admitted to a home care organization needs to have a fall prevention screen done, then you know what? You need to do that fall prevention screen. So there are certain things that you need to make sure are always in place. So the bottom line truly is, quality is the responsibility of everyone at all levels of the organization. So you need to be involved in it, and I hope that you learn to embrace it as much as we do. As evidence-based practitioners with clinical postgrad degrees, you operate through direct access in most states and in all of Canada. We are situated to incorporate the quality of care initiatives into our routine practice. It is critical that we do that. I just want to speak briefly about different accreditation bodies in the U.S. There are a couple of accreditation bodies that we're going to touch on, but there are other ones as well. So please don't feel like I've given you everything. I just want to expose you to accreditation. And why would an organization want to be accredited? Well, basically what happens is some insurance companies will not sign a contract with a new vendor or a new facility providing care unless they're accredited by an external agency. The federal government has gotten so backlogged in starting new home cares and hospices. The only way you can start a new home care and hospice is if you go through an accrediting agency to do that for you. So there are reasons why you would do it. The accreditors truly believe, and I'm kind of that ballpark as well, is that if you look at your policies and your procedures and you're always doing quality care and quality improvement, that you always stay on top of your game and that the patients are never compromised. And for example, if we talk about Joint Commission, it's a huge organization. They monitor all types of facilities. However, the basic premise for Joint Commission is patient safety. Everything they do is works around patient safety. And I think none of us would disagree that patient safety is vitally important. I'd like you to all go out and take a look at Joint Commission National Patient Safety Goals. Joint Commission comes out every 3 years to reevaluate an organization, and then every year and a half you have to do a periodic performance review. That means you have to look at all your policies and say, are they still being met? Are they not? And basically, companies that go through Joint Commission accreditation really tend to be the stronger companies who are committed to hard work to assure that quality is always being met and that the highest patient safety is achieved. And that's all I'm going to say about Joint Commission. There's the National Committee for Quality Assurance, and this accredits healthcare organizations and managed care plans. I don't have a lot of experience with this, but it's the same sort of thing. They measure performance of how that healthcare organization, that insurance company, meets the needs of the patients within their plan. Are they responsive? There's also CARF, which is another accreditation organization, and this tends to focus on adult daycare facilities, rehab facilities, behavioral health, and so on. And CARF is quite big in nursing homes as well. And as is Joint Commission. I mean, and a company can choose whichever accreditation company they want to use, a facility or a program. They're going to use the one that their administrative team feels the most comfortable with, has used in the past. This is just another little external accountability for nursing homes that I do want to touch on. And basically, what this talks about is, it talks about that the federal government said a while back, patients in nursing homes weren't being treated with respect. They didn't feel that perhaps there were some nursing homes out there that were doing a great job, but then there were others that really weren't doing a good job at all. And so they passed this act that requires every resident attain and maintain their highest practical physical, mental, and psychosocial well-being. Restore and maintain function is our goal in physical therapy, and that's why within nursing homes it's a huge push to include PT and OT regularly in the care and services of patients. Patients do age, there's no question about that, but we want them to age in a safe, quality manner, and we want them to not age in such a manner that they develop bed sores and die because of an infection, as opposed to their chronic disease. And we want to make sure that they're comfortable at the end of their life. So the states go out to make sure that patients are treated well. So that's our public health. And they go out and they want to make sure patients are treated with respect and dignity. And that's where you'll see they've taken away a lot of use of restraints in nursing homes, use of chemicals, medications to drug patients. They want to make sure that minimal amount of restraint is used on patients, because it builds the ultimate amount of respect to our patients, that they really are people, and how do we treat them as people. Your documentation within the skilled nursing facility is essential, because if they find that you're not meeting the standards, they'll be fined, they'll deny payment, they'll transfer residence, and they'll even close residence. So it's really important that your documentation when you go into a skilled nursing facility is timely and thorough so it meets all the guidelines. And this is just the regulations for long-term care. I'm not going to delay on that. And quality control in private settings. I think that a lot of private settings may not have a formal process. However, payers routinely review for medical necessity, appropriateness of care, and reasonableness of services. So I was contracted with a number of years ago by Medicare to do reviews of physical therapy outpatient charts, because they wanted to say, did this meet the regulatory requirements? So I had to review all of these records from this one particular provider, and he was flagged because he did they do averages. So let's say for every patient who has a knee replacement, what they do is they take all of the people across the country who provide care for knee replacements, and maybe the average number of visits per knee replacement might be 12. And so when they put in all the data into their massive databases, they have what's called outliers. And outliers could be people who don't provide enough visits or people who provide too many visits. So they're going to target the outliers within those ranges to see why is this the case. Or perhaps this person has a lot of patients with a particular type of diagnosis, and they're saying, you know what, we want an expert to come in and look at that care and say, was this reasonable, evidence-based, and standards of care? So what is appropriate for a quality assessment? I think it is the most important thing within our practices that we have to maintain. We have to identify what's important, how are we going to do it, and what are we going to do to eliminate any problems from occurring, and recognize that errors are going to happen. But if we identify them and change our processes, we can prevent them from injuring our patients, and that's what it's all about. So, Joint Commission, just to jump back briefly on Joint Commission, they actually implemented the surgical timeout, which was a whole process that they found out in hospitals that sometimes patients would go in and the physician would remove the wrong limb. Let's say the patient had a gangrenous right foot and the doctor would inadvertently remove the left foot. And these horrible accidents would occur. And so hospitals have developed a number of safety checks to prevent this from happening. Now, does it still happen? Yes, and if you go out on YouTube, you'll see some narratives from some nurses that have been put in quite compromising situations. However, by putting these processes in place, we help to minimize the effects of this. I'm just going to very briefly go over the last few slides because I know this has been quite lengthy, but I really do believe that quality is the most important aspect of what we do. There are also out there for hospitals, nursing homes, home health agencies, and hospices what are called quality improvement organizations. And these are healthcare experts that get teams together to talk about what is great care and how can, as an organization of these different types of care providers, provide what is considered great care. So it looks at, it might have all quality people from hospitals or quality people from skilled nursing facilities, and they get together and they talk about what are the common problems that occur and what can we do to prevent them across all disciplines. And so I'm just going to talk about in home health. Again, it's where I have most of my experience, but best practices were what were the areas that were happening and what did we need to do. So best practices are, how can we reduce rehospitalizations for our patients? How can we make sure things like Katrina happened many years ago, and we found that there were not the communication and the emergency networks in place to care for and follow our patients and help our patients be successful should an emergency occur. So emergency care plans, fall prevention programs. One method for home health best practice is see the patients pretty intensively the first week they're home, because that's when they're the weakest and the most compromised and most confused. And by doing that, we can decrease their rehospitalization risk. Put together programs on disease management. So again, it's evidence-based standards of care, and how does the whole team work together? How does the nurse and the therapist and the OT and the PT and the OT and the social worker, how do they all work together to help that patient learn how to manage their chronic disease? So you can read all of those. So basically, the four principles behind healthcare quality improvement is to have a strong focus on our patients, adopt a continuous improvement process, involve the entire organization, and utilize objective data and team knowledge to improve our decision making. The last couple slides just show that what you might do, examples of indicators and strategies for improvement. So these are the small plans, and then it goes through the larger annual plan. So what are you going to do? Perhaps once a year you're going to look at your medical equipment and make sure that your annual safety checks are done. So your ultrasound machine, your hot pack machine, you're going to have them calibrated every year and check to make sure that there's no burning issue, that they're doing exactly what they should. But in the short term, perhaps you have a daily monitor of the temperature of the hot pack machines to make sure that it's never outside of a range. Or you have a daily monitoring of your refrigerator if you keep any medications in there. Or quarterly patient outcomes and patient satisfaction surveys. As I mentioned, you do that all the time. Anytime a survey comes in that's really not a great one, you follow up with. So this is an annual plan that looks at patient safety, patient outcomes, patient satisfaction, staff performance, and so that's really a well-rounded plan. So the whole thing about quality is preventing medical errors. Do you know, in medical errors, 7,000 patients die each year because of sloppy handwriting. 7.5 million unnecessary medical and surgical procedures are performed annually. More than half of the U.S. population has received unnecessary medical treatment. That equates to about 50,000 people per day. 42% of people have been directly affected by a medical mistake, a procedure, or a drug problem. And 84% of our population personally knows someone who's been a victim of medical error. I can go on and read more and more to you, but the most important thing is to recognize that it's a problem and that we all have to work to assure that the highest quality is always not only set in place, but monitored and achieved at every neck along the way. Thank you.